Hey students, this is Dr. Ways and welcome to your lecture on the neck. So the neck is a pretty complicated space with a lot going on in there, so we'll try to unpack it as best we can, showing you first the organization and then the contents that are within the neck and how they all work with each other and are organized along with each other. So the picture on the right here shows two different sides. Take note that this is anterior and this is posterior, so you're as if you're looking down on a neck that's had the head taken off. And on the left side here we have all of the fascia, and on the right side we have all of the compartments, but keep in mind that both the fascia and the compartments are going to be on both sides. It's just an easier way to label them. So we'll start here with the pretracheal fascia, and you notice that that pretracheal fascia goes all the way around what we consider to be the organs of the neck, and that's going to make the visceral compartment. All right, the visceral meaning all the organs that are specifically within the neck. Then we have superficial fascia, and that superficial fascia is going to be here, this layer right here, under. That's going to contain the fatty layer, like we've seen previously. And then we have something called the carotid sheath. And the carotid sheath is, of course, called that because it surrounds the carotid arteries, but you also see it surrounds a vein and a nerve. And we'll talk about what those three structures are and how they course in the next few slides. Okay, and then we have investing fascia, which is more of your deep fascia that you're used to considering. And notice that goes all the way around both sides, so it's that purple layer. And then we have prevertebral fascia, which is going to surround all of the vertebrae, the spinal cord, as well as the muscles that are surrounding the vertebrae also. So with the carotid sheath and the vein, artery, and nerve that are in there, that's going to form the vascular compartment. Compare that to the visceral compartment. And then what the prevertebral fascia surrounds is going to be then considered the vertebral compartment. So we have 1, 2, and there's two sides, so number 2 has a left and a right, and 3 compartments, all surrounded by fascia known as pretracheal, carotid sheath, and prevertebral. And then the picture on the left here is just showing you pretracheal fascia, where that would be on a lateral view, sagittal section of a person in the pretracheal space. All right, so all of this is really considered neck. Then we have our prevertebral layer right here, that pink, showing where that is. We have the fascia space within the prevertebral layer right here, and you see the investing layer right here. It's a little harder to see on this picture, so I apologize for that. A little easier to see on this picture. All right, if we look carefully at the carotid sheath right here, remember we said that there were 3 structures in there: 1 artery, 1 vein, and 1 nerve. So specifically, it's going to be the common carotid artery that's in there, and you notice that is more medial, just on either side of the esophagus. The internal jugular vein, and you notice that's more anterior and lateral to the common carotid artery, anterior and lateral. And then the nerve that's in there is going to be the vagus nerve, all right, the vagus nerve, which is cranial nerve 10, and that's going to be located posterior to both and in between or intermediate of both the carotid artery and the internal jugular vein. All right, and you're going to have one on the left side and one on the right side. And then this is just a little cartoon drawing showing you the same setup. Notice that this is a different orientation than this picture right here, whereas this is anterior and this is posterior, whereas this is anterior here and this is posterior. So when you're looking at pictures and looking at these things, don't get yourself confused. Make sure you are knowing exactly what position you're looking at so that you can get straight where the structures are, because where you say they are is going to depend on what orientation that you know you're looking in. All right, so if this is anterior, then this would be more medial, and this would be more lateral, as this little compass here suggests. All right, so here we see the common carotid artery, internal jugular vein, IJV, although that's a little bit hard to see, and then the vagus nerve, intermediate between the two, and posterior. All right, the bones we've already went over when we talked about the back, but now we want to think of them in association with the structures that are anterior to them, since we're talking about the whole neck, not just the back of the neck. And so the first two bones are going to be C1 and C2, which are your atlas and the axis. All right, and those are going to be directly right here, C1, C2, C1, C2, right here. And you notice that they are in alignment with about the level of the maxilla right here. So C1 with the maxilla, C2, the upper teeth in the maxilla, or maxillary teeth, if you will. C3 to C4 level is your chin, and then C5 to C6 level is just below your Adam's apple here, your thyroid cartilage. And then of course we know that this is C7 right here, so your vertebra prominens, and that's going to fall, of course, below the level of the thyroid cartilage, the level of the larynx, if you will. There's one bone in your body that is not articulated to any other bone in the body. It's kind of free floating, although it is attached to membranes and muscles, and at a distance to bones, but not like we usually see articulations, and that's going to be the hyoid bone. Hyoid bone. And it looks almost like it would be a vertebrae, except it's not a complete ring, and it has these little, looks like teeth at the anterior end. So this would be the body, these would be lesser horns, and that's, which is extending backwards, would be the greater horns. And you notice that it lies right here at about the level of the mandible, just superior to the larynx. And it's an important anchor for a lot of the muscles and soft tissues within the neck. In relation to the vertebrae, it lies at the level of about C3. All right, so there are several cartilaginous structures that are within the neck that are important to know, and we're gonna describe them here, or at least talk about where they're located. But we'll go into more detail about what they do and why they are arranged the way they are when we get to the section on the larynx later on. All right, so we have this, so here's your hyoid bone, just for reference, and here's your thyroid cartilage. Okay, and your thyroid cartilage is called the thyroid cartilage because it's associated with the thyroid gland. And the thyroid gland would sit about right here within the neck. Okay, so even though it's associated with it, you don't see it directly sitting on top of the thyroid cartilage. All right, so don't make that mistake. One of the things you'll be doing in physical exam lab is doing a thyroid examination. And when we get to thyroid, we'll talk about that a little bit more, and specifically where the thyroid is. But you don't want to get mixed up and say, all right, I found a thyroid and it's right on top of the thyroid cartilage, because that's not true. All right, below that we have the cricoid cartilage, all right, which is the last ring of the larynx before you get to the actual rings of the trachea. So remember, the trachea, when we talked about the respiratory system, has these incomplete cartilaginous rings, what we call C-shaped rings. And the reason why they're C-shaped is because in the back we have this collapsible tube called the esophagus, and when food's going down the esophagus and it pushes on the trachea as it's passing by, this part will bulge into the actual trachea, and rather than damage cartilaginous tissue, you have this soft tissue here that is condensable, so that you can make room for food going down the esophagus. All right. And then you also have the epiglottis here, and all of these are going to make up the structure we know as the larynx. All right, so we have the larynx right here, what you see bracketed here, and then below that we have the trachea and incomplete rings. And again, the purpose of those incomplete rings is to make sure that the trachea doesn't collapse on itself. We always want airways to be open. Like we've seen in other places within the body, the neck also has triangles to it. So this picture right here is going to be really important because what you see is the neck with the head completely extended backwards. And so you're going to have triangles here. You have anterior triangles, and notice there's one on the right side and one on the left side, and they go up around the rim of the mandible and down to the jugular notch of the sternum. Okay, and the lateral borders then would be the sternocleidomastoid muscles. And I have a note here, make sure you know the borders. When you get to physical exam lab, they will expect you to know what the borders of the neck triangles are. So make sure you know what the neck triangles are, where they're located, and what their borders are. So that's the anterior triangle. If we look at the posterior triangle, we have the medial border now being the sternocleidomastoid, the inferior border being the clavicle, and then the lateral border here being the trapezius muscle. And we'll mention the neck triangles, otherwise known as the cervical triangles as well, when we are going through the rest of this lecture. But the main reason you're going to need it is in your physical exam lab when you are doing lymph nodes, feeling for lymph nodes. One of the things that's required of you is to know the borders of the neck triangles and the lymph nodes that are associated with them. So you're going to find most of the lymph nodes running along the borders of the triangles. So if you know where the borders of the triangles are and you're running your fingers along them, if there's a infection or pathological condition going on, you should be able to feel them. The anterior triangle is then subdivided into smaller triangles that are shown here. So we have the submandibular triangle, so that is just below the mandible. Of course, the superior border is going to be the mandible. The posterior border is going to be the stylohyoid muscle, and we'll go over all these muscles as we move along. And the anterior border is going to be the anterior belly of the digastric muscle. So that's your submandibular, and that makes sense because it's under the mandible, hence submandibular. Our submental triangle is this really tiny triangle right here. Remember, mental refers to chin, so it's under the chin. All right, so here's your bone, here's your chin right here, so it's in that space underneath the chin. With the border, inferior border being the skin, the superior border being the anterior belly of the digastric muscle, and the posterior border being the hyoid bone. Then we have the muscular triangle, and the muscular triangle is called that because it's bordered by large muscles within the neck. So the posterior border superiorly is going to be the superior belly of the omohyoid muscle. The inferior portion of the posterior border is going to be the sternocleidomastoid muscle, and then the anterior border is going to be the skin, with the superior border being partially associated with the hyoid bone. And then we have our carotid triangle right here, posterior border being the sternocleidomastoid, superior border being the posterior belly of the digastric muscle, and the anterior border being the hyoid bone, as well as the superior belly of the omohyoid muscle. And then we have a couple other smaller triangles up in this region that we're not going to generally talk about. Next, we'll start getting into the muscles of the neck, beginning with the most superficial muscle in your neck, and that is known as the platysma. All right, notice the platysma extends all the way back about halfway up at about the halfway point on the lateral portion of the neck, and wraps all the way around to the middle of the both anterior triangles, and goes down here just below the clavicles and connects up here within the lower border of the mandible. And it is, despite the fact that it's very broad, it's also a very, very thin muscle, and its function is basically elevation of the skin on the neck. And so if you see, look at this picture right here, all of these ridges right here that she's doing as she's making this face, this is a picture I pulled off the internet, so this is not somebody I know, are made because of the contraction of that platysma muscle. So we call it a subcutaneous muscle because it's contained within that superficial subcutaneous layer. So it's not going to be able to move anything like we normally think of muscles doing, but it's more involved in expression and, like it says here, elevation of the skin of the neck. Innervation, facial nerve. All right, and once we get into the facial nerve, and the muscles associated with the facial nerve, we'll notice that the facial nerve is involved in muscles that are involved in facial expression. All right, and so it would be no surprise that this would be any different. Next, we have the sternocleidomastoid muscle, which I think is a fun muscle because the name tells you exactly where it's located. And you know, when you contract this muscle, it kind of sticks out, and it's I don't know, fun to see. So here is the sternocleidomastoid, starting at the sternum right here, running along the clavicle. That's the cleido part, and then all the way up here to the mastoid process of the skull. All right, and then back down. So all of this is sternocleidomastoid. And its actions, one, if you contract it, you're going to have rotation of head to the opposite side, because as it's pulling the back of the head, it's going to pull the back of the head this way, and the front of your head's going to go this way. So that's what we mean by rotation to the opposite side. And also flexion of the head at the neck. So when we pull on this, it's going to pull the head down and allow us to do a flexing motion if it's just pulled straight down. The nerve associated with that is the spinal accessory nerve, cranial nerve 11. All right, now we're going to get into muscles of the anterior triangle of the neck, what's referred to as the infrahyoid group or strap muscles. And the reason they're called the strap muscles is because they look like straps. So the two that are on this page are the sternohyoid, which is this muscle right here, and you can see it looks like a strap running from the sternum up to the hyoid bone. And we have the omohyoid, which looks like a strap running here up to the hyoid bone. Here is a tendon between the two, and then the other belly of the omohyoid muscle going down here to the superior border of the scapula. All right, both of these have the same function. When they contract, they're going to pull on that hyoid bone, and that's going to be important for movements associated with speech as well as swallowing. And the nerve that supplies these two muscles is the ansa cervicalis. All right, and we'll talk about the ansa cervicalis later on as we go through this lecture. All right, and just to note that omo refers to shoulder, so the omohyoid tells you that it goes to the shoulder. So again, telling you exactly where the muscle is located. All right, here we see the ansa cervicalis, and ansa simply means loop. Cervicalis means it's in the neck, so a nerve that is a loop in the neck. So here is the superior root right here, and here is the inferior root, and they are coming off as from the anterior rami of C1 through C3. And the muscles that we specifically just talked about, the omohyoid and the sternohyoid, would be innervated by the superior root of the ansa cervicalis because they're located more anteriorly as the superior root is. And just for reference, it is called the superior loop because it begins more superiorly than the inferior loop. All right. You know, if you're thinking of why the superior and inferior when it's anterior versus posterior, that's the reason why. Continuing on with the strap muscles, we have the thyrohyoid muscle running here from the thyroid cartilage to the hyoid bone. So the name tells you exactly where it's located. And we have the sternothyroid running from the sternum and the medial border of the clavicle up to the thyroid cartilage. All right, now keep in mind when they say thyroid, they're not going to the thyroid gland. Here's a thyroid gland right here. It's going to the thyroid cartilage, which is above the thyroid gland. All right, they have similar functions as to the last two strap muscles, which is depression of the hyoid as well as the larynx during speech and swallowing. But one other function that the thyrohyoid has is that it's able to elevate the larynx. So if it contracts, it can pull the larynx up during speech and swallowing as well. The thyrohyoid muscle is innervated by C1 via the cranial nerve 12, the hypoglossal nerve. And the sternothyroid is innervated by the ansa cervicalis, which we saw in the previous picture. Now, what does that mean, that C1 via the cranial nerve 12, the hypoglossal nerve? So here we see the hypoglossal nerve. It's the one that's more superior that I have in blue here, or my blue is just above it. And then below it you see a thinner nerve. That is going to be C1, and you see that it's going down here to the thyroid cartilage, and it's going to go to the thyrohyoid muscle. And so by this comment, C1 from the anterior ramus is traveling with the hypoglossal nerve, but it is not actually part of it. All right, next within the anterior triangle, we still have the suprahyoid group. So now we're out of the strap muscles, we're in the suprahyoid group. So that means they're going to be above the hyoid instead of below the hyoid. And those, there are four of those: the digastric, the stylohyoid, mylohyoid, and geniohyoid. Typo here, that's supposed to go up here, and it's that way in your lecture notes, so I apologize for that. And these are color-coded, so everything that's in green over here is associated with the digastric. Everything in gray is associated with the stylohyoid, blue the mylohyoid, and red the geniohyoid. And so here you have the digastric muscle, and digastric means two-bellied. So you'll have one on either side. Here is the left digastric anterior belly, and the left digastric posterior belly. So you know, notice it's going from the anterior portion of the mandible on the posterior side around and back to the mastoid process all the way up here. You don't see where it goes here, but up here you can see it goes to the mastoid process. The mylohyoid muscle in blue here and down here is this broad fan-shaped one that is more superior relative to the digastric muscle. Then we have the stylohyoid, which is going from the stylus process of the sphenoid bone to the hyoid bone. And the last one is the geniohyoid muscle, which is right here, superior to that of the mylohyoid muscle. And notice over here that the geniohyoid actually forms the base of the root of the tongue as it's attached to the mandible and to the hyoid bone right here. And all of these muscles being above the hyoid are mostly responsible for raising the hyoid bone during speech or swallowing. So this is a good picture right here. What I would recommend is looking at this picture and seeing if you can identify the muscles based on what was gone over in the previous few slides. And it will also help you because these are muscles that are on your structure list to be found in the anatomage table during lab. So a good study guide for you guys looking at a real cadaver muscles and then comparing them to what you see in the lab. All right, major blood vessels that you'll see in the anterior triangle of the neck. We have the brachiocephalic vein here off of the superior vena cava, which branches into the right internal jugular vein, which we saw that's part of the carotid sheath, and the right subclavian vein. And we're going to have that on both sides, so the left brachiocephalic, left subclavian, and left internal jugular vein. And then here we have the aortic arch, and coming off the aortic arch is our left common carotid artery, our left subclavian artery, and on the left side, and on the right side we have the right common carotid artery and the right subclavian artery. Now remember that on the right side, the common carotid artery and the subclavian artery don't come directly off the aortic arch like they do on the left side. They come off of this brachiocephalic artery. So the brachiocephalic artery is not part of what is in the anterior triangle neck blood vessels, but the ones that branch off, the right common carotid and right subclavian, are. So just something to make note of. All right, notice here that the carotid triangle is called the carotid triangle because you have both the external carotid artery as well as the internal carotid artery, which are branches of the common carotid artery, running through it. So a couple notes about the common carotid artery. Notice that it branches off into the internal and external just inferior to the border of the sternocleidomastoid muscle, and there's a little dilation here at that bifurcation, and that is known as the carotid sinus, and that is going to be, and we have already talked about that in physiology. That's where the baroreceptors and chemoreceptors are going to be located that detect changes in blood pressure and pH. And then the spot right here where the external and internal carotid arteries are within the carotid triangle is a spot where you can feel for the carotid pulse. So another good reason to kind of have an idea about where these triangles are. Some information about the carotid arteries. So here's that carotid sinus that we mentioned. Notice it's a little dilation. The internal carotid artery does not give off any branches to the neck. It's going to go straight up into the skull and supply the cerebral hemispheres with blood. But then if you look at the external carotid artery, you notice it gives branches almost immediately after it branches from the common carotid artery. The first branch being the superior thyroid artery, right here going down to the thyroid gland. All right, then you can notice some other ones. I don't have them highlighted, but the lingual artery right here, the facial artery right here, the maxillary artery right here, superficial temporal artery right here. So lots of branches that are coming off of that external carotid artery. So again, just to keep things in perspective, internal carotid artery associate with the brain. External associate with the head. All right? Then the major veins draining the parts of the head that run through the neck are your internal jugular vein right here. So notice that's a very large vein that's internal to the sternocleidomastoid muscle. And of course that's going to drain the cerebral hemispheres in the brain. And then we have the external jugular veins out here that are just on the outside of the sternocleidomastoid muscle, and those are going to drain areas coming from the head. So you can see the external jugular vein kind of travels along the sternocleidomastoid, so it's neither at that point in the anterior or the posterior triangles of the neck, because remember the sternocleidomastoid kind of marks the boundaries between the anterior and posterior triangles of the neck. But as it goes down into what we call the root of the neck, and we'll talk about that later on, then it becomes part of the posterior triangle. So then you also notice that the internal jugular veins are part of the anterior triangle of the neck, since you can see them. Here would be the dividing line, and there's the triangle. So they'd be in the anterior triangle. All right, so here we see a gross version of the internal jugular vein, and then the external carotid artery right here running next to it. So notice that the jugular vein is posterior to where the external carotid artery is. And we can also see that over here, the internal jugular vein, and here would be the external carotid artery. At this point, the internal carotid artery has moved more medially, so it's not in the same plane laterally as the external jugular vein, or I'm sorry, external carotid artery and internal jugular vein would be. But the point of this slide is the nerves of the anterior triangle of the neck. So we've already seen the superior root of the ansa cervicalis right here, and notice that it's running along with the internal carotid artery right here. So when looking for it, that's an easy find. If you find the internal carotid artery, you'll find the ansa cervicalis, and of course down here it's going to loop, so another easy way to find it. Here we see the hypoglossal nerve, and then the anterior ramus from C1 running along with it. And remember, that is going to go to the muscle in the anterior neck, the thyrohyoid. And then we also have cranial nerve 9, the glossopharyngeal nerve, coming out here and sending off branches to various parts of the neck. All right, glands of the anterior triangle. The primary one being the thyroid gland, and remember the thyroid gland is invested within this pretracheal fascia right here, just anterior to the trachea. So this part right here is what we call the, write it over here, isthmus, joining the two lobes of the thyroid gland that have a butterfly shape that wrap around either side of the trachea here, just underneath the cricoid cartilage, and the superior borders of the lobes touching the lateral portion of the thyroid cartilage. All right. Also notice that the thyroid gland is just medial to the common carotid arteries right here. And then sometimes you'll see this pyramidal lobe that goes up to the hyoid bone. And it's a variant. You're not going to find it in all of your patients, and you probably won't be able to feel it. It's going to be in about maybe 10 to 25% of patients, or people rather. So when you're doing your thyroid examination, which you'll do in the first couple weeks of your physical exam class, find the thyroid cartilage, the inferior base of it, and then go down maybe about a finger, and you'll be right on the isthmus of the thyroid gland, and then go to either side, and you should be able to palpate the gland itself. And there are some maneuvers that you can do that will bring out the thyroid a little more prominently. And I'm not remembering exactly what they are right now, but you'll get that in for sure in your physical exam lab. If we turn the thyroid around and look on the back side, what we'll see are these 4 little glands. Of course they're colored orange here, and the thyroid gland is pink, but in the real thyroid there'll be little islands of tissue that look different than the surrounding tissue, and those are going to be your parathyroid glands. All right, remember the thyroid gland secretes hormones T3 and T4, whereas the parathyroid gland will secrete parathyroid hormone which is involved in calcium regulation, whereas the thyroid is involved in regulating basal metabolic rate. The arterial supply to the thyroid gland comes from the superior thyroid artery, which is a branch from the external carotid artery, as well as the inferior thyroid artery, which is a branch of the subclavian arteries. And since the parathyroids are within the thyroid gland itself, they will also be supplied by branches from the superior and inferior thyroid arteries. Drainage of the thyroid comes from thyroid veins, middle thyroid vein, superior thyroid vein, as well as inferior thyroid veins, which will drain into nearby larger veins and eventually back into circulation through the heart. All right, now we're going to move on to the posterior triangle. And the posterior triangle, of course, is right here, bordered, excuse me, anteriorly by the sternocleidomastoid and posteriorly by the trapezius muscle. And then what's inside of it is this big blue void. Actually, we're going to cover what's inside of it over the next couple slides. But whatever's inside of it has to be deep to both the trapezius as well as the sternocleidomastoid. So when we do our dissections in the lab on the anatomage table, make sure you take these away so you can see clearly the muscles that are underneath it. Primarily what you'll have in there are your scalene muscles. And scalene muscles, think of a scalene triangle, which is a triangle having sides that are unequal in length. So these are triangular shaped muscles that have unequal sides. So they're divided into your anterior scalene, your middle scalene, and your posterior scalene. And notice that the three of those are oriented more anteriorly. All right, so anterior being the most anterior, middle being just posterior to that, and the posterior being just posterior to the middle and deep to both of those muscles. They're going to be involved in lateral flexion of the neck, so think of moving your ear down to your shoulder. That's what we mean by lateral flexion, as well as elevation of the first rib if we're talking about the anterior and middle, or the second rib if we're talking about the posterior. And so why do we want to elevate ribs? Those are going to be involved in breathing, accessory muscles for taking a deeper inhalation. Innervation for the scalene muscles comes from ventral rami that are within that region. So ventral rami from cervical spinal nerves. The other muscles that you see here within the posterior triangle are ones that we've already covered. So here you have the levator scapulae muscle, as well as the splenius capitis muscle that we talked about in previous lectures. But since those were more associated with the back rather than the neck, we're not going to discuss them any further here. We've already talked about how the external jugulane courses along the sternocleidomastoid muscle, but then enters into the root of the neck in the posterior triangle. So here we see that space that's in the posterior triangle right here. And then it gives us off branches also that are actually branches are coming into the external jugular vein from areas that are within the posterior triangle. And one example of that is a posterior external jugular vein. All right, for the purposes of comparison, I'm going to draw in the borders of the sternocleidomastoid that were taken out to show what's underneath. So notice that you have your internal jugular vein as well as your common carotid artery underneath the sternocleidomastoid muscle when you're looking from the lateral view. So they're definitely not going to be in a posterior triangle. Remember, we can see them from the anterior triangle, so that's where they're going to be located. But what we can see in the posterior triangle are branches coming off of the subclavian artery. such as the transverse cervical artery right here, as well as the suprascapular artery and the thyrocervical trunk right here. All right, which then eventually goes to other branches that go to the neck as well as to the thyroid gland. And notice that all of those arteries that we just mentioned traverse superficially to the anterior scalene muscle, as well as the middle scalene muscle. Remember back when we were talking about the axillary artery and it had different parts? It turns out that the subclavian artery also has different parts. The first part is just before it passes deep to the anterior scalene muscle. The second part is here between the anterior scalene muscle and the middle scalene muscle. And then the third part is as it's passing out of from behind the anterior scalene muscle and going out into the arm, where it will eventually become the axillary artery. Nerves that are within this region, we have the phrenic nerve, right? So here we see the phrenic nerve right here running down. And again, here's the border of the sternocleidomastoid, so that's falling within the posterior triangle. And then you can also see branches from the brachial plexus as well. And notice that those branches, let me erase some of this here. Notice that those branches are occurring between the anterior scalene muscle and the middle scalene muscle. So the brachial plexus is going to branch out between those two scalene muscles. All right, so what we're looking at here is an anterior view of this body, and we've stripped away a lot of the things that are normally running up the neck. And so you can see, the trachea cut away here, the esophagus cut away here, as well as superficial muscles cut away. And then you can see all of these smaller muscles that are running up the length of the neck along the body of the vertebrae. And so these are our longest capitis muscle and our longest colli muscle. And these are weak flexors of the head because they're located anteriorly, but they're located more in the middle of the head rather to the front of the head, and they're small muscles, so their effect on flexion of the head is not going to be as strong as some of the other bigger muscles that are located more anteriorly and have more leverage to pull, as well as larger muscle mass. All right, but the point of this slide is to show another plexus that you should be familiar with, and that's the cervical plexus. So the cervical plexus, of course, would be in the cervical region, and it's going to be made up of branches from C1, C2, C3, C4, and C5. All right, two of the branches you've already seen, and that is going to be the superior root of the ansa cervicalis, here coming off of C1, and that's going to come down, loop, and give off branches, of course, and then come back up and be tied into C3 as well as C2. So the ansa cervicalis is really made up of branches from C1, C2, and C3. And then we have this superior part and the inferior part down here. And then we also have the phrenic nerve, and we've discussed this in quite a lot of detail in previous lectures. And the phrenic nerve is actually coming from branches from C3, C4, as well as C5. And of course, that's going to go down to primarily, we talked about the diaphragm, all right, and be involved in breathing. And of importance to note is that all of the nerves involved in the cervical plexus come from the ventral rami of the cervical nerves. Okay, so this picture is just showing you the phrenic nerve and reminding you that it comes from ventral rami of C3, C4, and C5, and here you see it coursing down. So its beginnings are in the posterior triangle of the neck, but then it courses underneath the sternocleidomastoid muscles and anterior to the scalene anterior muscle. Okay, another thing that I want to point out here, it's not part of what we're talking about in this slide, but here you see the internal jugular vein, the common carotid artery, and the vagus nerve right here all together. So those all wrapped together are going to form what we called within the carotid sheath. And so I just saw that there, and I wanted to make sure I pointed it out that from a lateral view we can see the components of the carotid sheath here. And let me erase so you can get a better look. Okay, a little more detail about the ansa cervicalis. It has two roots, and we discussed this a little bit earlier. There is a superior root that is up here, right here. There would be a superior root. It's comes from C1, of course. We talked about that in a previous slide. And it's going to connect with the hypoglossal nerve. So by connect, we mean run along with it. All right, and then it's going to course down, and it's going to loop and connect with the inferior root, which starts at C2 and C3. All right, so now that we know that the superior root comes from C1 and the inferior root comes from C2 and C3, it makes sense why they're called the superior and inferior root instead of the anterior and posterior roots. All right, and even though we've already talked about it, the ansa cervicalis is going to supply all muscles of the infrahyoid group, so the strap muscles, except for the thyrohyoid. And remember, the thyrohyoid is supplied by C1 alone. Okay, the root of the neck is this area that is right here, and we've talked about this as the superior thoracic aperture. So it's the area above the superior thoracic aperture, bounded by the sternum, the manubrium of the sternum here, as well as the clavicle, although that's not pictured here, and the top and the superior borders of rib 1. And then posteriorly by the T1 vertebrae, all right, which is associated with the, of course, rib number 1. And so what's in it are extensions from the thoracic cavity, which would be the cervical portion of the parietal pleura, as well as other structures that are connecting the thoracic cavity to the neck, to the head. So that would include the trachea, esophagus, and the muscles, nerves, and blood vessels that are contained within it. So what are the blood vessels? Well, the vertebral arteries from C6 up. So if this is C1, 2, 3, 4, 5, 6, C6 up. All right, and remember the vertebral artery only goes from C1 to C6, but not C7 right here. The only thing you'll find in C7 is the vertebral vein. And not to confuse you, it's not all of this that's part of the root of the neck. It's this part that's the root of the neck, so the vertebral artery that's going to eventually go up through those transverse foramen. We have the subclavian artery, right side and left side, as well as the branches that are coming off of the subclavian artery. And then, although they're not pictured here, there will also be the subclavian veins and the axillary veins within the root of the neck as well. So remember, generally speaking, it's going to be this area here. All right, everything that is right around in this area. Nerves associated with the root of the neck include the phrenic nerve. All right, we see the phrenic nerve here in the root. Okay, and it's going to pass down here. So here would be the true root of the neck. Remember, this is the border of it, as well as the vagus nerve. Here you see the left vagus nerve right here. The right vagus nerve would be on the other side, of course. And although you do see other nerves there, I'm not holding you accountable for those particular ones in terms of the root of the neck. If we strip away most of the, and we've seen a picture like this before, most of the uh, organs and blood vessels and nerves that were anterior to the sympathetic trunk, we can actually see the sympathetic trunk as it's associated with the cervical vertebrae. So here would be the trunk right here, and ganglions associated with that trunk that are within the cervical region. And remember, the sympathetic trunk is involved in fight or flight responses from the autonomic nervous system. And so they're going to go to all those things that we see here and activate most of them. So, dilate pupils, increase heart rate, increase breathing rate, things like that. But it will also decrease digestive activities and decrease urinary activities and sexual activities, because we're not going to need those in a fight or flight situation. All right, so just a reminder of what the sympathetic trunk or the sympathetic nervous system does. Notice how branches of the cervical vertebrae are going into the ganglion that make up the sympathetic trunk. So you're going to have branches coming from these rami of the cervical spinal nerves that are going to help make up the trunk. It's coming from C5, C6, so all of them. And they're going to make up nerves that affect blood vessels within the neck region, such as the carotid arteries here. Remember, the carotid sinus is right here, so it's going to make up part of the reflex system that's involved in maintaining blood pressure and blood pH. Also notice that it has branches that go to the heart, the middle cardiac nerve, inferior cardiac nerve. So it's involved in the sympathetic nervous system is plugged into the heart through the sympathetic trunk within the cervical region. Right, cervical nerves supply the dermatomes to the head and the neck. So here you see C2 in the ear and posterior neck region, as well as the posterior head. C3 posterior neck and anterior neck. C4 posterior and anterior root of the neck. And then from about a midpoint of the head all the way forward around the mandible and just anterior to the ear is not supplied by cervical spinal nerves. It is supplied by branches of the trigeminal nerve. And once we get to that section, we'll talk about the trigeminal nerve and its branches and which parts of the face that they actually innervate. Notice that there is no dermatome for C1 because C1 primarily carries motor neurons. So that's why you're only going to see dermatomes for C2 onward, because there is no dermatome for C1. In fact, the only real sensory component of C1 is involved with the dura mater. Lymphatics, here is where we finally get to see where all of the branches of the lymphatics empty into. So, excuse me, all of the lymphatic branches and lymphatic nodes that are along the way all empty into the subclavian veins, whether it be the left subclavian vein or the right subclavian vein, at what we call trunks. So here we have the subclavian trunk because it's running along the subclavian vein, the jugular trunk coming along the right internal jugular vein into the right lymphatic duct. All right, so the right lymphatic duct would empty directly into the right subclavian vein, and the branchiomediastinal duct would empty right into the right subclavian vein too. So of course that tells you exactly what that's draining is the bronchi as well as parts of the mediastinum. The thoracic duct we've talked about quite a bit That is the main duct system for a lot of lymphatics that are from the lower part of the body. And that's going to curve around and join with the jugular trunk running along with the internal jugular vein, the subclavian trunk running from the left subclavian vein, and go in through what is still called the thoracic duct. So the thoracic duct is going to empty right into the subclavian vein. And then you have another bronchiomediastinal trunk from the left side. All right. So finally, we see where all of this lymphatic fluid is emptying into, and important to note that it's at the subclavian vein near the junction where the brachiocephalic vein splits off into the internal jugular and the subclavian. All right, and here is a picture showing your lymphatic nodes, your lymph nodes that are within the head and the cervical region. And these are going to be of primary importance because these are ones you're going to palpate within your physical exam lab. So all the ones in green are the ones you should take note of as ones that you're going to be assessing and have to know for physical exam lab. All right, so remember we said that the sternocleidomastoid, which I just outlined, is a dividing line between the anterior triangle and the posterior triangle. And here we see occipital nodes at the superior border of the posterior triangle. We see actually on the sternocleidomastoid, we see superficial cervical nodes. All right, so we should be able to see those. Find the sternocleidomastoid and feel all the way up. You'll be able to feel those superficial cervical nodes. Deep cervical nodes, you won't be able to feel as much unless they're really, really infected or affected somehow. And so you'd feel those by wrapping your fingers around the sternocleidomastoid muscle once you find it. And then, of course, you have your submandibular nodes, your submental nodes. I'm constantly checking these in my children whenever they're sick to detect if they have indeed a infection within their associated with their throat and neck. And then above those triangles, of course, we have our preauricular or parotid nodes. And so, again, showing you why that these triangles are important and where lymph nodes are in association to them. So these are ones you're really going to have to know. And then, of course, we have over here, excuse me, a superficial model of the head showing you in even more detail where some of these lymph nodes are. And, of course, if you want to, here is where your sternocleidomastoid muscle would be, and you can see where they are in relation to that. So practice, practice, practice. The more you practice this and try to feel them on yourself. You're not going to be able to feel most of them. Try to feel them on yourself. Try to feel where they are on other people, and get into the habit of doing this because, a lot of the patients that you're going to see if you're in primary care are going to come in like, my throat hurts. I have a cough, I'm sniffling, and you want to assess, and especially kids, assess their lymph nodes, see what's affected, and see if they indeed have an infection or something else may be going on.